Hey guys, today we're going to be on chapter 37 with special considerations for your peds and your geriatric patients. You guys should have already read chapter 37. We have been working on pediatric dosing formulas, Fry's rule, Clark's rule, Young's rule, also milligrams per kilogram. I do have a pre-recorded Zoom of me actually working some of those pediatric dosing problems. You guys already have the study guide in chapter 35 lecture, so we're going to jump into 37 on page 634, page 634 in your textbook. Go ahead and highlight all the definitions on page 634. And while you guys are highlighting, I'm going to give you guys key words you're going to be looking for and try to break down these definitions so it doesn't just feel like words. So we have neonates. You guys do need to know the difference between neonates and what is considered an infant, because that makes a huge difference. This is why we do not use any more pediatric dosing. We're using body surface area, also milligrams per kilogram, because we were having too many mistakes. I mean, you can have a neonate that's, 15 pounds. We see stories where, a woman had a baby and the baby was 15 pounds. We cannot dose that baby the same way because, real life, that's like a peds patient, right? So neonates is a child from birth to 1 month, and then you have your infants. It's 1 month to 2 years old. So you guys do need to know the difference between infant and neonate. We have pharmacokinetic. Pharmacokinetics is pretty much how drugs are going to move throughout your body. We call this process ADME. The PTCE will refer to it as ADME. So pharmacokinetics, go ahead and highlight that definition as well. And make sure you guys know what ADME stands for. That's my absorption, distribution, metabolism, and excretion of your medication. You also have the definition of absorption is pretty much how the drug is going to enter into the bloodstream. IM, the reason why you guys do need to know what is IM versus IV, because a lot of medication for your pediatric patients, believe it or not, will be administered IM, as well as your geriatric patients. And that's because their body is metabolizing drugs differently. Also, a lot of peds patients, they and also your neonates, they're not going to swallow medication. They're not going to swallow tablets. Your babies, they're going to start to spit the liquids out. So the best route of administration for them, even though we don't like to see it, would be IM, not IV. You guys have pH scale, you have water soluble, liquid soluble, and also distribution. So you guys will need to know those definitions on page 634. On page 635, they're talking about the drug metabolism. With your pediatric patients, we do know that your liver and your kidneys are the main organs that are going to be used when you're trying to metabolize drugs. With your pediatric patients, their organs aren't fully developed, right? So the medication is going to stay in their body a little bit longer, which puts them at risk of pretty much having some type of drug toxicity, drug poisoning, or something like that. You can easily overdose these patients just because you may say, a lot of you guys want to say, oh, do I draw up 7 mLs or do I give the patient 6.8 mLs of their medication? If it's 6.8, you're going to give them 6.8 mLs. You won't round up to 7 mLs because we can draw up 6.8 mLs in a syringe. And that's another way how we can actually prevent these patients from actually having some type of overdose, because the drug, again, will stay in their body a little bit longer just because their organs aren't fully developed. Underneath the drug metabolism, they're talking about certain drugs that we shouldn't pretty much dilute the patient's medication with. So I'm going to be on that second paragraph underneath my drug metabolism. They're saying that medication containing benzyl alcohol, such as bacteriostatic sodium chloride that we use to dilute powder. Now, bacteriostatic chloride, this is pretty much a clear injection, a solution that we dilute our powder with, give it a little shake. They're saying we shouldn't use that with our pediatric patient because it can reach toxic levels. So you guys may have a question where I'm asking, Is it safe to use bacteriostatic chloride to dilute your powders for your pediatric patients? The answer is no. It's not, safe for these patients. Also, they're talking about phenobarbital, how phenobarbital with your older patients and your infants, how it's going to metabolize slower. And then another thing that you guys do need to know is that last sentence at the bottom underneath my drug metabolism, where they're talking about tetracycline. Tetracycline is an antibiotic. Tetracycline, if you ever think of some of the older adults, they may have a stain, a brown stain, or maybe a yellow stain on their teeth. Tetracycline, one of those side effects, besides it being photosensitivity, meaning you shouldn't be exposed to the sun for a very long time while taking this medication. Tetracycline can cause you to have stained bones and teeth, meaning your bones and your teeth can turn like this deep yellow brown looking color. So go ahead. That's where is it? Tetracycline. That's underneath my drug metabolism. Like that last sentence where they're talking about tetracycline. Also steroids. They don't really like giving patients steroids because it can stunt their growth. But I do want you guys to know about tetracycline. That's that last sentence. That's one of those crazy side effects about that drug. Underneath my pediatric medication administration, they're talking about how tablets and capsules are not easily, your pediatric patient, they can't swallow it, a lot of them. I know my little brother and, my kids at home, it took them a long time for them to be able to swallow those medications. You will have to compound it. A lot of the pediatric dosing, the dosage forms will be IM, and then also you may have liquids that you may have to compound. A lot of the medications are already pre-mixed into a liquid. If you don't have it, then you guys actually compound it. And then they're also stating underneath that passage that we use body surface area, which that's a whole nother ball game. You guys will learn that formula with body surface area. Go ahead and highlight the two definitions at the bottom of page 635. That's metabolism and excretion. Pretty much how your body is going to handle this drug, how it's going to process this drug, and then how your body is going to pretty much eliminate that drug, because the drug don't just sit in your body. You have to eliminate it some type of way. That info box on page 635 is pretty much stating that it's not safe. The FDA recommends that you do not have like OTC cold and flu products for your pediatric patients because it can be very, very damaging to them. A lot of your cold and flu products have what? Acetaminophen, right? Acetaminophen processes in the liver. Their liver, we just read, isn't fully developed. So that's why those medications are deemed not safe for the patient. Okay, 636, they're talking about the different rules. You have Clark's rule on 636, and then you also have Young's rule on 635. They did not talk about Fry's rule, but in chapter 18, some of you guys already learned about Fry's rule, so I just added Fry's rules to the equation. And then they also have milligrams per kilogram, and that's on another recording that's posted today that you guys should be reviewing and going over. On page 637, underneath my common childhood illnesses, this is also on your study guide. You guys do need to know what is otitis media. Otitis media is a middle ear infection. You may say, oh, your kid has an ear infection. They have to put tubes in. That's what most people say. Oh, my child has an earache. They have an ear infection. They have to put tubes in. Well, that term, the medical term for that is otitis media. That is so common amongst your pediatric patients. Pretty much you get formed this almost like a blister in the middle of your ear. It can be damaging to the ear. It can cause the kid to have some type of speech impediment. They may have some type of hearing impediment if you don't take care of that. So I do want you guys to know what is the correct medical terminology for that middle ear infection. It's actually otitis media, and that's on page 637. Also, underneath the common childhood illnesses, that very last paragraph before my info box with the household teaspoon, that is saying that your antibiotics should be used for bacterial infections only. Pretty much I tell students, a lot of times you take medication, you're sick, you take your antibiotics, you begin to feel better, and then you stop taking it. Well, guess what? You may still possibly have that bacterial infection. What happens, your body is now becoming immune to it, and now you stop taking it. Now you're going to need more medication. You're going to have to prescribe an extra dose or a stronger dose of that medication if you don't take your antibiotics correctly. So that's why they're saying taking it for 7 days or take until complete. Take it for the next 10 days and not take until you feel better. You need to take the entire regimen of your antibiotics. That info box is just pretty much stating that your household teaspoon, meaning a spoon that we may be eating our cereal with, it's not the same as actually 5 ml. If you guys measure 5 ml into an oral syringe versus grabbing a teaspoon out of your cabinet in the kitchen, it is not the same. 1 teaspoon is pretty much 7.5 ml actually. You can fill about 7.5 ml with a teaspoon that you would actually eat cereal with. So all my life I was getting overdosed. I was getting overdosed because that's how my mom and my grandmother gave me my medication when I was younger. They would pour it on a teaspoon. But that's actually closer to 7.5 ml, which is 1.5 teaspoons. All right, now we're going to flip. We're going to go to page 640. Go ahead and highlight those definitions on page 640. We have my geriatric, which is my patients that are over the age of 65. You have side effects. You guys all know what side effects are. Pretty much, if you take this drug, what side effect would you have? If you take tetracycline, you may have what possible side effects? Stained teeth, stained bones. If you take steroids at a young age, what side effects may you have? It could possibly stunt your growth. You have these drugs half-life, pretty much the amount of time it's going to take your body to break that drug down by 50%. And then you have toxicity, meaning drug poisoning. Think about, some of these people that the medication may say take 1 tablet. And just because they see 5 milligrams, let's say that tablet is 5 milligrams, they don't think it works, right? Because 5 milligrams just cannot work. I need 10 milligrams, so they take 2 tablets. You have those who are addicted to opioids. They may get in a bad wreck. That prescription may say take 1 oxycontin every 12 hours. Well, guess what? I'm in a lot of pain. I'm gonna take 2. They don't feel like they're overdosing, but now it's not even safe for them at this point. Now you're just poisoning your body. So that's what that is. That's what drug toxicity is. On page 641, we have my disease drug interaction. So you guys probably heard me talk about drug interaction. And if you take these two drugs, they're going to interact and have some type of bad adverse reaction. Adverse reaction is just a worse side effect. You may have a side effect to where it may cause nausea, drowsiness, stomachache. Adverse reaction, that's when you have, the little lady come on stating if you or anyone you know have taken this medication and, have died, have died, or you lost a limb, or now you have cancer because you took this medication, that will be considered an adverse reaction, something like extreme, right? So now we have disease drug interaction. A lot of your older patients, they have multiple illnesses, right? It's like once you turn a certain age, you're just sick. You have high blood pressure, you have diabetes, uh, Alzheimer's, dementia, high cholesterol, you have all of this, right? So they're stating that because you have all of these diseases, sometimes your medication is going to interact, weird with your disease, which puts you at a bad adverse reaction. Maybe they're dealing with depression or something like that. Well, we just learned that if you're depressed and you're taking a MAOI, some type of antidepressant, you shouldn't take what? You shouldn't take what? Y'all should be able to answer that question because we just talked about it. If you have dementia, you're going through Alzheimer's, certain medications you just should not take. It's either going to help you, but in terms it may make the disease worse and actually kill you faster than a disease. So that's what your disease drug interaction is talking about, and all of these bad adverse reactions. On page 642, highlight that definition at the bottom, non-compliance. I can talk about non-compliance for about a year because my mother is always non-compliant. Non-compliance is just pretty much you're doing what you want to do. The doctor may say, hey, think about for the pandemic. We need to what? Wear a mask. That's all I'm gonna say. We need to wear a mask, right? And what we're not doing. A lot of us just refuse to wear a mask. We're in non-compliance. Um, they may say, hey, you guys need to take this vaccine. What are we not doing? And I'm guilty of it. I'm guilty of it. I have not taken that vaccine yet. I'm still on the fence with it. So that's being non-compliant. My mom, the doctor may say, hey, guess what? You should not have liquor. You should not consume anything that contains alcohol. That's what she's going to do. Still going to drink her beer. That's non-compliant. Or you should take this medication at this time. She may say, oh, I'm going to take it later. I'm going to take it tomorrow. I don't like the way that medication makes me feel. All of that is being non-compliant. And you have that mainly, more so with your older patients because they forget. Like, they have dementia, Alzheimer's, and they literally forget to take their medication. And that's why now you have your weekly little medication containers. Now places are now pre-packaging your medication for the whole week. If you're taking your medication in the morning, every pill you're taking in the morning is going to be in a package for you. Every medication that you need to take at night is going to be in a package for you. So that's why you have a lot of companies now are doing unit dosing and pre-packaging of their medication. They're making a killing off of that. They're making a complete killing. On page 642, they're talking about the role of the pharmacy technician. A lot of these bullets are kind of questionable because if you're not careful, then you cross the line of scope of your practice. We cannot counsel a patient at all. What we can do is read the directions on a bottle, on a OTC product, on their prescription medication. We can read the leaflet to them. We can explain to them what we're doing. One of those bullets say, greet the patient by name and mention their name often. Okay, that's why we have that little red line in Walgreens saying, stand behind this line. A lot of time in the smaller chain pharmacies, they greet all of their patients by name. What if I'm picking up my HIV meds? I don't have HIV. I'm just saying, what if that patient is picking up their HIV medication and you're, hey, Mr. Bob, and Mr. Bob is picking up their HIV medication, and that technician didn't know, oh, Mr. Bob had HIV. If you're not careful, then now you're doing HIPAA violations. Now you're putting yourself at risk to lawsuits. Another one that was kind of questionable for me is when it was saying pretty much make advice and be as specific as possible. We cannot make advice. We can talk to the patient. We can do things like, hey, Mr. Bob, I saw your A1C levels were down, meaning you're taking your medications. Good job. Thank them for that. Or hey, your blood pressure looks normal. I see you've been taking your blood pressure medication. Oh, I saw your Coumadin levels look great. I see you taking your medication, Mr. Bob. You're looking good. We can do things like that, but we cannot counsel a patient at all. So that's why those were more questionable for me. You have to be extremely careful with those bullets. On page 643, highlight that definition at the bottom of polypharmacy. Polypharmacy, where poly means many or a lot, and then pharmacy, we're talking about medication, right? So pretty much when you're older, again, you're sick, you have diabetes, you have high blood pressure, high cholesterol, you may have cancer, dementia, all of this stuff, right? Polypharmacy is when they're going to prescribe multiple medications for either the same disease or multiple conditions that you may have. And that puts the patient at risk for disease-drug interactions, drug-drug interactions. So polypharmacy is huge. It's pretty much more popular with your older patients, your geriatric patients, because again, when you're older, you're more sickly. It must be something in the water, right? On page 644, they're talking about ways of how you can actually help that patient. Not around here too much. We do the brown bag method. Pretty much they bring all their medication in and you pretty much go over each drug that the patient is taking or should be taken based off their patient's profile. You have brown bag methods. You also have what I just told you guys about, where they're pre-packaging all of the medication. If you're taking Lasix in the morning, you're also taking some type of statin drug in the morning, they already have that in the packet for you. You just open it up, take it. If you're taking, your high blood pressure medication and your Ambien at night, they already have that pre-packaged for you. You just open it up, take it. It's no thinking. Everything is already done for you. So that's another way that we can actually help the patients, offer some type of service like that to them, so they're not the blister packs, so they're not overdosing, underdosing, and they actually understand, what medications they're taking and when to take it. Again, you should not be taking Lasix at 10 o'clock at night. I mean, you're going to be up forever. You should not be taking Ambien in the morning. You're going to sleep all day. Some people do it, but it's supposed to be, administered at night. And then we also have MTM, which is my medication management therapy, and that all goes along with the brown bag method and actually unit dosing or making those prepackaged blister packs for your patients while dealing with polypharmacy. So chapter 35 and 37 is going to be a combined exam. You're going to have the pediatric dosing exam actually on at Moto, and that's going to upload Monday for you guys. So pediatric dosing Monday is 100% all pharmaceutical. And then you're going to have the paper exam for chapter 35 and 37 Tuesday in the lab. If you guys have any questions, please do not hesitate to contact me. But that's all I have for you guys. Adios.